So it's very common these days for people to have things like pacemakers in place or spinal cord stimulators for some reason that they can't get an MRI scan. An MRI scan is really the gold standard. If you had to pick only one study, that might be the one to get. But people that have implants like that prohibit them from getting an MRI, in those situations we get a study called a myelogram. So myelography is a procedure that is done typically with a CAT scan. The way that that's done, this animation shows really nicely, is that people will have a spinal tap or a lumbar puncture performed, and that's usually done by the radiologist, and it usually takes about 15 minutes. And they put a needle in through the skin, so it's like a small needle stick, goes through the skin, between the spinous processes and into the spinal canal into what's called the thecal sac, and that's where the spinal fluid itself is. But a CT myelogram is a very valuable study to look at what's happening to the spinal cord and to look at what's happening to the spinal nerves when an MRI is not an option.